The job description of a registered nurse, RN, centers on delivering compassionate, evidence-based care to patients in a variety of healthcare settings. Registered nurses play a critical role in promoting health, preventing illness, and supporting patients through diagnosis, treatment, recovery, and end-of-life care. Whether working in hospitals, clinics, nursing homes, schools, or community health centers, RNs serve as the backbone of the healthcare system, ensuring that care is safe, effective, and centered on the patient's physical and emotional needs. Registered nurses combine clinical knowledge with interpersonal skills to assess patient conditions, develop care plans, administer medications, and collaborate with physicians and other healthcare professionals. Their role requires the ability to think critically, make quick decisions, and respond to changing health conditions. Because they often spend more time with patients than any other healthcare provider, RNs are uniquely positioned to identify complications early, advocate for patients' rights, and provide holistic support that considers not only medical conditions, but also psychological, cultural, and social factors. The scope of work for registered nurses can vary widely depending on their specialization, workplace, and geographic location. Some RNs focus on emergency care, while others specialize in pediatrics, geriatrics, mental health, surgical care, or community outreach. Regardless of specialty, all RNs are held to high ethical and professional standards, as their work involves direct patient care and often life-saving interventions. Flexibility, resilience, and a genuine desire to help others are essential traits for success in this demanding yet deeply rewarding profession. Core responsibilities of a registered nurse. A registered nurse's day begins with patient assessments. This includes checking vital signs, reviewing medical histories, and conducting physical examinations. RNs use their findings to identify health issues, prioritize care needs, and communicate any concerns to physicians or nurse practitioners. They play a key role in early detection of complications, particularly in fast-paced environments such as emergency departments or intensive care units. Medication administration is one of the most regulated and critical aspects of nursing practice. RNs ensure that patients receive the right medications at the right dosages and times. They monitor for side effects, educate patients on drug regimens, and report adverse reactions promptly. Nurses must be proficient in calculating dosages, using intravenous IV equipment, and maintaining sterile techniques to minimize risks. Care coordination is another central responsibility. Registered nurses are often the primary link between different healthcare providers. They communicate updates to doctors, guide patients through diagnostic procedures, and ensure smooth transitions between departments or levels of care. In community settings, RNs may coordinate with social workers, public health officials, and family members to support ongoing treatment or rehabilitation. RNs are also educators. They teach patients how to manage chronic conditions such as diabetes or hypertension, explain post-operative care instructions, and offer guidance on nutrition, hygiene, and medication adherence. In many cases, they educate family members on how to care for loved ones at home, thereby improving recovery outcomes and reducing hospital readmissions. Documentation and record-keeping are vital parts of the nursing workflow. Every observation, treatment, and conversation must be accurately documented in patient records. These records provide a legal account of care provided and are used by healthcare teams to guide clinical decisions. Attention to detail is crucial in maintaining clear, complete, and compliant documentation. In addition, registered nurses contribute to infection control, patient safety, and quality improvement initiatives within their institutions. They may participate in policy development, training programs, or audits to improve care standards. In high-stakes situations, such as medical emergencies or disaster responses, RNs play a leading role in triage, stabilization, and crisis management. Midway through the exploration of these responsibilities, it's important to highlight that the job description of a registered nurse extends far beyond basic patient care. It includes decision-making, advocacy, education, and coordination, all of which influence the patient experience and health outcomes. Skills and personal attributes required. To thrive in nursing, individuals must possess a unique combination of technical skills, emotional intelligence, and professional integrity. First and foremost is clinical competence. Registered nurses must have a strong understanding of anatomy, physiology, pharmacology, and disease processes. They should be able to interpret lab results, monitor medical devices, and respond to emergencies with confidence and precision. Communication is another critical skill. RNs must be able to convey information clearly and compassionately to patients, families, and colleagues. They must also be active listeners, able to recognize subtle cues about a patient's physical or emotional state. In multicultural settings, the ability to communicate across language or cultural barriers is particularly valuable. Empathy and patience are foundational to effective nursing. Registered nurses often care for people during vulnerable or traumatic moments. Their ability to remain calm, reassuring, and non-judgmental can significantly impact a patient's emotional well-being. At the same time, nurses must protect their own mental health by setting boundaries and practicing self-care. Problem-solving and critical thinking are essential, especially when working in dynamic environments such as emergency rooms or intensive care units. RNs must quickly analyze situations, prioritize actions, and adjust care plans based on evolving patient needs. Multitasking and time management help them balance responsibilities across multiple patients and tasks. Technological proficiency is increasingly important. Nurses use electronic health record (EHR) systems, automated medication dispensers, diagnostic tools, and telehealth platforms as part of routine care. Comfort with technology helps improve efficiency and reduces the risk of errors. Teamwork is at the heart of nursing. RNs work closely with doctors, technicians, therapists, and administrative staff to deliver coordinated care. They must be flexible, respectful, and cooperative, even under pressure. Leadership potential is also important, especially for nurses who wish to advance to supervisory or specialized roles. Work environment and career outlook. Registered nurses work in diverse environments, including hospitals, private practices, long-term care facilities, rehabilitation centers, schools, correctional institutions, and patients' homes. Each setting has its own rhythm and challenges. In hospitals, nurses often work 12-hour shifts, including nights, weekends, or holidays. In community settings, hours may be more regular, but often involve travel or outreach activities. The job can be physically and emotionally demanding. RNs are on their feet for long periods, may lift or reposition patients, and are sometimes exposed to infectious diseases or emotionally charged situations. Yet many nurses describe their careers as deeply meaningful and fulfilling, given the difference they make in people's lives. The profession offers strong job security and growth opportunities. According to global trends, the demand for skilled RNs continues to rise due to aging populations, increased chronic illnesses, and healthcare reforms. With additional training and certifications, nurses can specialize in areas like oncology, neonatal care, critical care, or anesthesiology. Others transition into leadership, research, education, or healthcare administration. Educational requirements to become a registered nurse typically include an associate degree in nursing, ADN, or a Bachelor of Science in Nursing, BSN, followed by passing the national licensure examination, such as the NCLEX RN in the U.S. Many employers now prefer or require a BSN, and further education can open doors to advanced practice roles or management positions. As we near the end of this detailed overview, it is worth reiterating that the job description of a registered nurse is both multifaceted and indispensable. Their presence touches every part of the healthcare journey, from birth to end-of-life care, and from prevention to recovery. Conclusion. The job description of a registered nurse highlights a profession built on care, expertise, and trust. RNs provide critical support to patients and healthcare teams alike, ensuring that medical treatment is delivered with precision and compassion. They manage complex clinical duties, adapt to evolving health scenarios, and advocate for the dignity and rights of every individual in their care. For those who possess empathy, resilience, and a commitment to lifelong learning, nursing offers not only a stable and respected career, but also the rare opportunity to impact lives daily. Whether in bustling urban hospitals or remote community clinics, registered nurses remain at the heart of health and healing, advancing well-being one patient at a time.